In this video, we'll talk about eating disorders. So first, let's talk about anorexia nervosa. The definition of anorexia means you have to have your BMI be less than 18.5, or your weight needs to be in less than the 10th percentile. Remember that BMI units are kilograms or meters squared, because sometimes questions will just give you the weight in pounds and the height in centimeters, and they want you to calculate it, and then if it's less than 18.5, then the diagnosis is anorexia. So the treatment for anorexia is CBT. It's important to remember you do not give any medications to treat anorexia. You can give medications for binge eating and bulimia, which we'll talk about next. It's also important to know when you need to hospitalize someone with anorexia. So if their BMI becomes less than 15, or if they have any electrolyte derangements, if they become bradycardic, hypothermic, anything like that where they're becoming unstable, you hospitalize them. So patients with anorexia, they can get refeeding syndrome. You'll know if they have refeeding syndrome by looking at their labs, and they'll have low phosphate, potassium, calcium, and magnesium. So because of these electrolyte derangements, patients with anorexia are more likely to develop arrhythmias. And because of this risk of refeeding syndrome with low phosphate and low potassium, you want to make sure you do not give them any TPN or high calorie diet. In the labs, you'll also find that people with anorexia have high cortisol levels, and they can also have reduced LH, FSH, testosterone, and estrogen because their HPA axis is off. And along with that, they can develop osteoporosis and hypoglycemia as well. Another psychiatric illness that's associated with anorexia is OCPD. Now let's talk about bulimia nervosa. So for this, you can treat with medication, and you can treat with SSRI, specifically fluoxetine or CBT. Both of those are first line. For bulimia nervosa diagnosis, you need to have symptoms for at least once a week for 3 months. So these patients, they'll eat a lot, and then they'll have a compensatory behavior such as vomiting or using laxatives. So because of that, vomiting causes a metabolic alkalosis, meaning you're going to have high bicarb, low potassium, and low chloride. They can also have high BUN and amylase in the labs as well. If they're using laxatives for their compensatory behavior, then they're going to be in a metabolic acidotic state. So for physical exam findings for bulimia nervosa, they can have teeth caries because of all the vomiting, they can have swollen parotid glands, and they can also have calluses on their knuckles, which is also called the Russell sign. Okay, now let's talk about binge eating disorder. For this, just like bulimia, you have to have symptoms for at least once a week for 3 months. Patients with binge eating disorder will eat a whole lot of food, but they don't have a purging or a compensatory mechanism like bulimia. To treat binge eating, you can do CBT and SSRI as well. You can also give medications that hinder their appetite or promote weight loss, so such as stimulants. You can also give topiramate and orlistat. And orlistat works by inhibiting pancreatic lipase, so that decreases your fat absorption. Lastly, we have avoidant or restrictive food intake disorder. So patients with this, they just have a lack of interest of eating, or they avoid eating certain foods because of the sensory characteristics of the food.